This video will give you detailed information about multifocal IOLs. Before we understand the multifocal IOL technology, let us first understand what happens if the patient goes for a normal option, that's the standard monofocal IOL. If the patient chooses this option, he will be able to see one particular distance clearly. So either it can be a distant object or a near object or something which is at the intermediate distance, and that would depend on what correction patient has chosen for himself. In other words, if the power is chosen to give good vision for distance, then glasses are must for near activity like reading or mobile viewing. So there has always been a desire in some patients who would like to do activities without having to depend on glasses. This is where multifocal IOL comes in picture. For such patients, bifocal, trifocals or EDOF lenses are available. Bifocal lenses have been in use for quite some time, and they give very good vision for distance and near, but intermediate distance is not good. So patients using a lot of laptops or mobile may find it little difficult. Extended depth of focus lenses give a very good vision for distance and intermediate, but for near, patient will need a small correction of approximately +1 diopters. For a normal monofocal IOL, they need a +2.5 to +3 diopter power in the glass to see near. Trifocals, as the name suggests, have 3 focus. So the patients with these IOLs will have good distance, intermediate and near vision without glasses. One very important point that we must understand, which is different from monofocal for these lenses, is that monofocal IOLs 100% of the light energy is used for viewing so that they get the best image quality, whereas multifocals divide the light energy proportionately so that there is a slight compromise in the visual quality for the convenience of being spectacle free. With this background, once we have decided to go for any of these IOLs, some of the very important points that you should clearly understand. Point number 1. In spite of multifocal IOLs in both eyes, there is still no guarantee that you will be 100% spectacle free. But one thing is for sure, that there is a definite reduction in glass dependency. Small power glasses may still be needed for certain tasks like reading very small prints or driving. These lenses works best when they are implanted in both eyes. There are a lot of times when the patient is not able to operate the other eye soon after the first eye surgery. So during this period, patient may find it difficult in doing activities without glasses. Once both eye implantation is done, in some patients it may take up to 1 year to get fully adjusted. To explain this further, immediately after surgery, patients may notice in night time glare, halos or starbursts around the source of light. This may make night driving, especially highway driving, difficult. However, with time, the effect of the symptoms reduce. Similarly, while doing near activity, with time, patient will find out the best distances at which he is able to read, see mobile or laptop. So 1 year should be considered as a period of training for your eyes to get adjusted to the new system. Determining the correct IOL power is of extreme importance. Our patients may be required to pay additional visits to the hospital. In the rarest of rare cases, the patient is not able to adjust with the lens. This lens can always be exchanged with a standard monofocal IOL anytime in future.